Yes, hello. Welcome back to another video about the EAVAST technique. We've been receiving some questions about what splint position we should use. My name's Jason Fairclough and I'm one of the innovators of the technique, and I hope to answer this question today. So the first thing to say is it depends on the type of fracture that you're dealing with. If you have a non-displaced fracture, regardless of whether it's simple or comminuted, you may find that the best position to use is a POSI splint, and we're just going to demonstrate that for you now. Here you can see a POSI splint. It's got MCP flexion and PIP joint extension, and that lovely traction force is creating a ligamentum taxis effect, which is going to help tighten the soft tissue and keep that fracture in good position. Thanks. You may also face more difficult fractures. They may be quite displaced. They may be malrotated. In these cases, you're going to need to adjust the vectors. If it's a malrotated fracture, if you're moving the finger in towards the scaphoid tubercle, you're going to create a correctional torsional force. That will be helpful to correct and reduce the fracture. The other type of fracture that you may face is a proximal phalanx fracture. In these cases, the extensor mechanism is going to tighten up distally, while the intrinsics and lumbricals are going to pull on the more volar aspect and the more proximal aspect, and that's going to create a volar apex fracture. In these cases, we strongly recommend that you bend the splint as much as possible distal to the fracture. So we're just going to demonstrate that now. So here we have a splint where the fracture is in the distal part of a proximal phalanx, and we're creating a torsionally realigning force as well as reducing that volar apex fracture by having as much flexion as we can. So those are the two types of splint positions that we recommend. You may put your foam in different places to adjust other vectors, but we'll deal with that later in another video. So thanks for watching. I wish you well with your patients, and I hope you get great success and great outcomes with the technique. And that's Jason signing off.